So when we think about ADHD, the picture that often comes to mind is pretty specific, isn't it? Like that kid in class who just can't sit still.
Exactly. That's the stereotype. Usually young boy, very hyperactive.
But what if that picture is, well, really incomplete? Especially when we're talking about how ADHD shows up in women.
That's such a crucial point. We might be overlooking a whole lot of experiences because they don't fit that narrow mold.
Yeah, it feels like there's much more to it than just fidgeting.
Absolutely.
Mm.
So today, in this deep dive, we're really going to get into that often missed world of ADHD in women.
Okay.
We'll look at how it can present differently, the specific challenges women often face, and maybe even some surprising strengths that can come along with it.
Sounds great. And we've pulled together some really interesting sources for this.
We're drawing on academic research that looks at this fascinating connection between ADHD and the menstrual cycle.
Oh, interesting.
Yeah, and also a really powerful qualitative study. It captures women's own stories about getting diagnosed later in life as adults.
And some articles too, right? Ones that focus on the differences between males and females.
Exactly, highlighting how ADHD tends to show up differently.
So the goal here, the mission for this deep dive is what? To kind of broaden the understanding.
Yeah, precisely. To provide a much fuller, more nuanced picture of ADHD in women. To move beyond those, kind of outdated stereotypes.
Hopefully offering insights that might resonate with you listening, or maybe help you understand people in your life a bit better.
That's the aim.
Yeah.
Okay, so where should we start? Maybe with how we even identify ADHD in the first place.
Good idea. And one of the first things that jumps out is that statistic you often hear, something like a 3-to-1 ratio, boys diagnosed compared to girls in childhood.
Yeah, that 3.1 figure comes up a lot, and on the surface, it seems like a really big difference.
It does. But is it the whole story?
Well, that's the interesting part. That ratio doesn't actually stay fixed. Research shows that as kids move into adolescence, and definitely by the time they reach adulthood, the gap narrows significantly. The numbers become much more equal between men and women.
Huh. So that initial childhood ratio, maybe it's not just about who has ADHD.
That's what some researchers are suggesting. It makes you question whether it truly reflects the prevalence across genders, or if something else is going on.
Like maybe something about the diagnosis process itself.
Exactly. There's research suggesting a potential sex bias baked into how we currently diagnose.
Okay, tell me more about that. A bias how?
Well, the idea is that the diagnostic criteria, or maybe how they're applied, might be more sensitive to picking up on what we call externalizing symptoms.
Okay, externalizing, like being visibly hyperactive or impulsive, things you can easily see.
Precisely. Things like restlessness, interrupting, difficulty waiting turn. And these behaviors, statistically, tend to be noticed more often in boys.
Right, because they might be more disruptive in a classroom, for example.
Exactly. So they're more likely to get flagged, which could lead to earlier assessment and diagnosis for boys.
Mm-hmm.
And what's also interesting is that even when girls do show these more obvious externalizing symptoms, they are still more likely to get diagnosed and receive support compared to girls with quieter symptoms.
So it's not just a number. This bias, if it exists, means potentially years of struggle for girls who fly under the radar.
Absolutely. Years of maybe feeling like something's wrong with them, feeling like they're failing without understanding why, that can really impact self-esteem.
So it seems like our expectations of what ADHD looks like are really key here.
They really are.
Yeah.
And that leads perfectly into how ADHD can actually, present differently in women and girls.
Right. Less of the bouncing off the wall stereotype, maybe.
Often, yes. While boys are more frequently diagnosed with a combined presentation that's having both inattentive and hyperactive impulsive symptoms, the research suggests women are more likely to primarily have the inattentive type.
Okay, so what does inattentive look like in practice?
Think difficulty sustaining focus, especially on tasks that aren't super engaging. Trouble with organization, losing things, being easily distracted, maybe seeming forgetful in daily activities, but often without that pronounced, visible hyperactivity.
And could societal expectations play into this? How girls are often expected to behave?
Oh, absolutely. That's a huge factor. There's often, more social pressure on girls from a young age to be quiet, attentive, polite, organized.
So they might try harder to hide any difficulties.
Exactly. This can lead girls and women with ADHD to develop coping mechanisms to consciously or subconsciously mask their symptoms.
Masking, like trying to blend in.
Yeah, essentially trying to cover up their struggles to fit social norms and avoid negative judgment, which of course makes their underlying ADHD much harder for parents, teachers, even doctors to spot.
So if the symptoms aren't always obvious on the outside, women might be dealing with more internal struggles instead.
That's very common. Instead of overt hyperactivity, you might see more internalized symptoms.
Like what, for example?
Things like feeling constantly overwhelmed, even by everyday tasks, intense self-criticism, feeling like they're never doing enough or getting things right. Significant anxiety is also really common.
And those things, overwhelm, self-criticism, anxiety, could easily be mistaken for something else, couldn't they?
Precisely. They can look a lot like primary anxiety disorders or depression. So the underlying ADHD might get missed and the person gets treated for anxiety or depression, but the root cause isn't fully addressed.
Wow, okay. That makes so much sense. And then you layer on top of that all the different roles women often juggle.
Right. Work, family life, maybe caring for others. Plus that whole concept of the mental load, keeping track of appointments, schedules, household needs.
Yeah, the invisible work.
Exactly. All of that demands really strong executive functioning skills, things like planning, prioritizing, organizing, managing time effectively.
Skills that are often challenging with ADHD.
Exactly. So those demands can really amplify the difficulties and become incredibly draining for a woman with ADHD, making her challenges even more pronounced.
Which then raises the question, what's it like when women do finally get diagnosed, often much later in life, after years of navigating all this?
That's a great transition to the qualitative study we mentioned,
Yeah.
the one that looked at women's experiences of getting diagnosed in adulthood.
Right. These were mostly university students in the UK, aged anywhere from 19 up to 56. What did they share?
Well, one of the first things that came up was that just getting the referral for an assessment wasn't always easy. They sometimes faced hurdles with their primary care doctors.
Like maybe not being taken seriously.
That seemed to be part of it for some. But then, when they finally did get the diagnosis, the reaction was often complex.
How so?
On one hand, it was frequently described as incredibly empowering, like a huge aha moment. Finally understanding why they'd struggled in certain ways for so long. A real sense of validation,
That must feel like such a relief.
definitely. But it was often mixed with other emotions too, like a deep sadness, even grief,
Grief. For what?
for the past difficulties, for the painful experiences they'd endured without knowing why, without the right support or understanding, thinking about how things might have been different.
Wow, that's a heavy mix. Relief and sadness all at once.
It really is. And the study also pointed out something else interesting. Some women struggled to fully accept the diagnosis even after they got it.
Why was that?
They talked about internalized ableism, sort of absorbing negative societal views about disability or neurodiversity,
Right.
and also the stigma they felt still surrounded ADHD. So there was this internal conflict, even with the validation.
That's tough. And what about support after the diagnosis? Did they feel like they got what they needed?
Unfortunately, that seemed to be a weak spot. The study highlighted a pretty significant lack of adequate mental health and psychological support post-diagnosis.
Really?
Yeah, and concerns about medication monitoring not being thorough enough sometimes. It sounds like getting the label was a crucial step, but the ongoing support to actually manage ADHD effectively wasn't always there.
So the system maybe wasn't fully set up to help them navigate things long term?
That seems to be the experience for many of these women. But what's really fascinating is why these women felt their diagnoses were so delayed in the first place. They had their own insights.
Oh, interesting. What reasons did they identify?
Several key things came up repeatedly. One was those traditional, often male-centric ideas about what ADHD is supposed to look like. That stereotype overshadowed their own experience.
Right, the lack of obvious hyperactivity.
Exactly. Another major factor was masking how skilled many of them had become at hiding their symptoms, making their internal struggles invisible.
We talked about that earlier, yeah.
They also felt there was sometimes a lack of knowledge among professionals specifically about ADHD in girls and women. And related to that, sometimes an overemphasis on diagnosing things like anxiety or depression without looking deeper for potential ADHD.
So misdiagnosis or incomplete diagnosis.
Potentially, yeah. And sadly, a recurring theme was simply feeling that their struggles and concerns weren't really listened to or taken seriously when they tried to explain them.
Gosh, that feeling of being dismissed when you're trying to get help must be incredibly frustrating. Did the study share any specific quotes?
It did, and they're quite powerful. One woman mentioned having an epiphany or a light bulb moment about possibly having ADHD after seeing something on social media, not from a doctor initially.
Wow.
Another talked about looking back and feeling her life had just been So much harder than it needed to be without the diagnosis, and feeling this sense of shame for not being able to cope like others seem to.
Those quotes really hit home. They show the real human impact of a missed or late diagnosis.
Absolutely. And it circles back so clearly to masking, doesn't it?
Yeah,
That effort to hide is such a huge part of why diagnosis gets delayed.
right. Let's dig into that masking piece a bit more. What does it actually involve for women with ADHD? What does it feel like?
Well, fundamentally, masking is about using conscious or unconscious strategies to hide neurodivergent traits, ways of thinking, behaving, interacting, basically to fit in and avoid standing out or facing judgment.
And it's particularly common for girls and women with ADHD.
It seems to be, yeah, likely because of those societal pressures we discussed, the expectations to be agreeable, organized, not too disruptive.
And we found some really raw firsthand accounts of this online, didn't we? In a discussion thread where women were sharing their experiences.
We did. It was incredibly insightful. People described the sheer mental effort involved, the constant monitoring of yourself, analyzing social cues, trying to respond correctly. It's exhausting.
Exhausting is the word that kept coming up.
Yeah, one person put it brilliantly, feeling like I have 25 tabs open in my brain all the time. That really captures the cognitive load, doesn't it?
It really does. Another mentioned working in a corporate job and forcing myself to be a super high-functioning employee for years, pushing through immense difficulties, only realizing the toll it took after leaving.
That drive to overcompensate. And what specific things were they doing? What were the actual masking behaviors?
Lots of examples came up. Things like consciously forcing focus during boring conversations, trying really hard to look interested.
Yeah, nodding along, making eye contact, even when your mind is completely elsewhere.
Right. Or reacting how you think you're supposed to react, especially at work, rather than how you genuinely feel.
The people-pleasing aspect came up a lot, too. Trying to be agreeable, not rock the boat just to blend in.
And suppressing physical energy.
Definitely. Being intentionally quiet to avoid being noticed. Or channeling restlessness into small, subtle movements, foot tapping, fiddling with a pen, doodling things that are less obvious than pacing or fidgeting more visibly.
And that perfectionism thing, that was interesting. Using perfectionism as a mask.
Yeah, that was a key one, especially professionally. Things like meticulous note-taking, keeping incredibly detailed records, having an immaculately organized workspace, almost overcompensating for internal organizational struggles.
But that takes a huge amount of effort, right?
Exactly. It often leads straight to burnout because maintaining that level of hypervigilance and control is unsustainable when it doesn't come naturally.
So there's this massive gap often between the competent, organized exterior that someone presents through masking.
In the internal reality of maybe feeling overwhelmed, scattered, or anxious.
Yeah. And letting that mask slip sounds terrifying for some.
It really does. Someone in that discussion mentioned how even something small, like using a fidget toy openly at work, felt like they'd just written ADHD in big letters on my forehead for everyone to see.
Wow. That fear of judgment is strong.
Huge. And they talked about how hard it is to stop masking, even with people they trust, because it becomes so ingrained. There's this deep anxiety about how people might react if they saw the real them.
Which brings up another angle. How might biology, like hormonal changes, interact with all these experiences?
Ah, yes.
Yeah.
That's a really interesting and emerging area of research, the connection between ADHD and the menstrual cycle.
Right. There was that theory about women with ADHD possibly facing a kind of double whammy with hormones.
Yeah, that's one way to put it. The idea stems from puberty, where hormonal changes have organizational effects on the developing brain, potentially interacting with ADHD neurobiology. But then there are also the ongoing activational effects.
Activational
Yeah,
effects,
yeah.
meaning the hormones cycling month to month.
Exactly. Researchers have proposed this novel theory looking at how the cyclical fluctuations of ovarian hormones, primarily estrogen and progesterone, might directly impact ADHD symptoms.
Okay, how so?
The main focus is on estrogen. The theory suggests that periods of rapid decline in estrogen levels might temporarily worsen ADHD symptoms.
Rapid decline. When does that happen?
There are two main points in a typical cycle. One is around ovulation mid-cycle, when estrogen peaks and then drops. The other is in the late luteal phase, the premenstrual period, when both estrogen and progesterone levels fall before menstruation starts.
And what's the proposed effect of these drops?
The hypothesis is that these sharp estrogen drops might temporarily reduce the efficiency of executive functions. Remember, those skills for focus, planning, impulse control. It's like estrogen helps tune those brain circuits, and when it drops quickly, the signal gets weaker momentarily.
Okay, so making it harder to manage ADHD symptoms during those times.
Potentially, yes. And the theory gets even more specific.
Oh.
It suggests these estrogen drops might interact with other cyclical changes. For example, around ovulation, there can be a natural increase in positive mood and maybe even approach risk-taking behavior. The mid-cycle estrogen drop combined with lower impulse control might amplify hyperactivity or impulsivity then.
Interesting. And premenstrually.
Well, the premenstrual phase is often associated with an increase in negative affect, irritability, low mood, anxiety. The theory proposes that the estrogen drop then, combined with reduced cognitive control, could particularly worsen inattentive symptoms, making focus and organization even harder during that time.
Wow. So the specific symptom profile might fluctuate across the cycle.
That's the idea being explored. And remember, this is all happening against the backdrop of any underlying brain differences from ADHD, plus the effects of puberty on brain circuits involved in emotion and the social pressures adolescents face. It's
No,
complex.
it really sounds. Is there any actual data supporting this yet?
There is some preliminary work. The researchers mentioned a small pilot study where they track hormone levels in ADHD symptoms. They found that declines in estradiol, a key form of estrogen, actually predicted about a twofold increase in self-reported ADHD symptoms.
A twofold increase. That's pretty significant, even if it's early research.
It definitely suggests it's an area worth investigating much further.
The article also mentioned neurosteroids briefly. What are those?
Yeah, neurosteroids like DHEA, pregnenolone, allopregnanolone, they're hormones produced in the brain or that act on the brain. They're known to influence mood and behavior.
And is there a link to ADHD?
Some research, mostly in boys actually, has suggested that lower levels of certain neurosteroids might correlate with more severe ADHD symptoms, especially hyperactivity.
But mostly in boys, you said.
Right. That's the big caveat. There's been very little research looking specifically at sex differences here, or investigating neurosteroids in girls or women with ADHD across the lifespan or the menstrual cycle. So it's another area where we just don't have enough information yet, especially regarding women.
It definitely sounds like there's a lot more to uncover about these hormonal links. It's so complex.
It really is.
But, it's so important we don't get stuck only talking about the difficulties and challenges of ADHD. We should also talk about the other side of the coin.
Absolutely. It's crucial to challenge that purely deficit-based view.
Mm.
ADHD isn't just a list of problems. It often comes with some really remarkable strengths, especially when you look at women.
Okay, like what kind of strengths are we talking about?
Well, creativity and imagination often come up. Many women with ADHD have this incredible ability to think outside the box, make novel connections, see things from really unique perspectives.
The divergent thinking.
Exactly. Also, sometimes that intensity of emotion can translate into deep empathy and sensitivity towards others, a real ability to connect with how other people are feeling.
That makes sense.
And resilience. Think about it, navigating years, often undiagnosed, in a world not always set up for your brain, requires developing incredible adaptability and perseverance.
That's a really good point. Learning to cope builds strength.
Definitely. And many find they have this passionate energy when they're engaged in something that truly interests them. They can become incredibly focus-driven problem solvers, diving deep into subjects they care about. That curiosity can be a powerful engine for learning.
So these aren't just nice to haves, they can be real assets.
Absolutely. In personal life, in careers, in creative pursuits, recognizing and harnessing these strengths is key.
Was there an example of that, someone shifting focus?
Yeah, that article from Progressive Therapy Associates shared a great little anecdote. A client who felt like she was barely getting by, constantly focused on her weaknesses, her executive function struggles.
Right.
But by working to shift her focus, to identify and lean into her strengths, like her creativity, her ability to connect with people, while also getting support and strategies for the challenging areas, she moved from just surviving to actually thriving.
That's fantastic. It really shows the power of a balanced, strengths-based approach.
It really does. It's not about ignoring the challenges, but about not letting them define the whole picture.
Okay, that feels like a really good place to maybe start wrapping up. If we were to summarize the key things listeners should take away from this deep dive.
I think the biggest thing is that ADHD in women often looks different. It's not always that classic hyperactive picture.
Right, more inattentive symptoms, often internalized.
Exactly. And that, combined with societal expectations and the tendency to mask, frequently leads to missed or late diagnosis, which has a huge personal impact.
And we learned about the potential role of hormonal fluctuations, how the menstrual cycle might interact with symptoms. That's a really important layer.
Definitely. But just as important is remembering the strengths, the creativity, empathy, resilience, passion, that can also be part of the ADHD experience for women. It's not all negative.
So the real aha moment, maybe, is realizing that our standard view of ADHD has been too narrow. It hasn't fully captured women's experiences.
Precisely. And understanding these differences is just vital. Vital for better diagnosis, for providing the right kind of support, and for women themselves to achieve greater self-understanding and acceptance.
It feels like opening up the definition is key.
It really is. And maybe that leads to a final thought for you, the listener, to chew on.
Okay.
How much might our wider societal expectations and maybe a somewhat limited view of what's normal neurologically be shaping how we perceive ourselves and the people around us?
Like how our definition of normal affects who gets seen and who gets missed.
Yeah. And what might change, what new possibilities could open up if we really made an effort to broaden our understanding of conditions like ADHD and truly appreciated the diverse ways human brains can work.